pandemics have shaped urban environments, how we know them today. Yellow fever led to the boulevards of Paris and public parks. Cholera created London's sewer systems. And COVID-19 is certainly not the first real health crisis New York City has been through, from yellow fever to tuberculosis to the 1918 flu. The headlines may read the same, but with each wave of contagious illness, they have helped shape the city seen today. Tom Hanson takes us to the Lower East Side of Manhattan.
People are really giving so much thought as to how we can rethink every space, from parks to offices to our houses to the cities as a whole.
Where many people see our urban areas struggling, Architectural Digest editor Samuel Cochran sees possibility.
I think it's an exciting time for architects and designers. No idea is off the table.
Cochran believes the next chapter in public health and urban areas is here. He told us all you have to do is look to the past.
So this street tells a story about public health in New York City.
I think that's right.
David Favaloro runs the New York City Tenement Museum, founded in 1988 after it had been shuttered for more than half a century.
How interconnected are urban planning and infectious disease?
I would go so far as to say one of the core threads that underlies the way we've thought about city building, really from the late 18th century to the present, has been in the interest of improving the city's resiliency in the face of public health crises.
Your museum actually provides a snapshot of New York City public health in a way.
Yeah, these buildings have seen everything from yellow fever to cholera to tuberculosis to polio. We're in the second floor hall here.
The walls of the Tenement Museum date as far back as 1863, when New Yorkers lived and worked in tight spaces.
It was not uncommon to operate a garment factory making clothing, manufacturing clothing out of your home.
Making a living in the living room.
Making a living in the living room. They believed that germs like tuberculosis, other airborne diseases could actually attach itself to a dress like this.
And a toxic combination of poor air ventilation, no running water, and no proper plumbing made these tenement apartments a vector for infectious disease to spread.
This was the bathroom.
This was the bathroom for the entire building. 22 apartments, 22 households, 80 or so people using 4 outdoor toilets.
With contagious diseases tearing through parts of the U.S., housing regulations changed their building codes to include access to open air.
This is the building 103 Orchard Street. When this was a residence, this air shaft would have provided light and air into the interior rooms of the apartments below us.
And that would have been all the more important with airborne diseases.
Right, the light part being the idea that sunlight often can kill bacteria or viruses, tuberculosis or something like COVID-19. All right, so here we're in the kitchen.
There were also changes made to the interiors of buildings with the 1901 Tenement House Act, which required windows between rooms.
So this would not have been an original part of the house.
That's correct.
It seems like when it comes to urban planning, we always are reactive.
I think that's absolutely the case, and that has always been the case. It's an interesting, I think, conundrum. How do you be strategic and proactive about public health, about something that's unknown, in some cases?
And in the era of COVID-19, that's a question architects like Joe Iacobellis are attempting to answer yet again. His firm, Mojo Stumer Associates, designed the interior of this major development in Long Island City just before the pandemic.
They're at a very unique point in that they're having to respond to COVID, having already finished most of their construction, finding ways to redesign around the new realities of COVID. They're going to be one of the first to market to really see how people respond.
The team and other architects around the world are responding with modern technology.
There are advances in UV light technology that can help to kill or eliminate the growth of germs and bacteria on surfaces. There will be advances in air filtration technologies and the number of air changes per hour in public spaces, antimicrobial surfaces, things like touchless faucets and face sensors and voice activation. All of those things are going to help us navigate a post-COVID world and be safer and be healthier.
Cochran says using lessons of the past is important to catapult design and architecture into the future.
There's going to be a lot of, I think, renewed attention and care taken to rethinking these spaces, and I think there'll be a lot of goodwill towards investing in those spaces for the good of society. So yes, going forward, I think certainly the built environment as a remedy for health concerns is a profound opportunity.
For CBS This Morning Saturday, Tom Hanson, New York.
Fascinating.
We've said this
Really.
before, but think about how different our lives are going to look for the next 20, 30, 40 years based on just what's happened in the past 8 months.
Right, and whether or not it's in battling a pandemic or just the flu.
Right.
Obviously, so many of these things can make a difference.
Yeah, it's amazing what tragedy sort of lifts up and lifts out for the future when it comes to our buildings and our cities and how they're planned.